Muscoskeletal disorders and pregnancy. Women of childbearing age have falls or other accidents that lead to bone fractures or muscle sprains. A chronic musculoskeletal disorder that may be seen with pregnancy is scoliosis. A woman with scoliosis. Scoliosis is a spinal lateral curvature that appears in girls between the ages of 12 and 14. If left untreated, it can cause deformity, interfering with respiration and heart function due to chest compression. Pelvic distortion, especially at the pelvic, may cause problems during birthing. Endocrine disorders and pregnancy. Endocrine disorders have the potential to be serious complications of pregnancy because enzymes or hormones control so many specific body functions. A woman with a thyroid dysfunction. As a normal effect of pregnancy, the thyroid gland enlarges or hypertrophies slightly because of increased vascularity and blood flow. A woman with pre-existing thyroid problems may have difficulty making this pregnancy transition. Nursing diagnosis, risk for maternal and fetal injury related to pre-existing thyroid disorder during pregnancy. The outcome evaluation is to no congenital anomalies are present in infant at birth. Apgar score is 7 to 10. Mother can continue pre-pregnancy level of activities. A woman with a hypothyroidism. Hypothyroidism is a rare condition in young adults and especially in pregnancy because women with symptoms of untreated hypothyroidism are often anovulatory and unable to conceive. Women with hypothyroidism fatigue easily and tend to be obese. Their skin is dry or myxedema and they have a little tolerance for cold. The symptoms of hypothyroidism are rapid heart rate, exophthalmos or protruding eyeballs, heat tolerance, intolerance, nervousness, heart palpitations, and weight loss. Hypothyroidism in pregnancy is usually caused by Graves' disease. It occurs in 1 to 4 of every 1,000 pregnancies in the United States. Graves' disease is an autoimmune disorder. With this disease, your immune system makes antibodies that causes the thyroid to make too much thyroid hormones. A woman with diabetes mellitus. An endocrine disorder in which the pancreas cannot produce adequate insulin to regulate body glucose levels. Affects 3 to 5% of all pregnancies and is the most frequently seen medical condition in pregnancy. So, diabetes during pregnancy. Diabetes often occurs as type 1 or diabetes which occurs in childhood and represents failures of the pancreas to produce adequate insulin for body requirements. Type 2 diabetes traditionally has occurred in older adults and represents gradual failure of insulin production that occurs with aging. The incidence of type 2 diabetes in adolescents has increased dramatically in the last decade related to the obesity in adolescents. So now both type 1 and type 2 diabetes are seen during pregnancy. Classification of diabetes mellitus. There are type 1, type 2, gestational diabetes, and impaired glucose homeostasis. Risk factor for gestational diabetes are obesity, age over 25 years old, history of large babies that are 10 pounds or more, history of unexplained fetal or perinatal loss, history of polycystic ovary syndrome, family history of diabetes, member of a population with high risk for diabetes. So, monitoring a woman with diabetes. A woman who is diabetic with type 1 or type 2 should meet with her obstetrician before she becomes pregnant. During this period, her condition can be well regulated so that hyperglycemia does not develop during the early weeks of pregnancy, when the tendency for congenital anomalies in the fetus is highest. Patient teaching, education regarding nutrition during pregnancy, and education during exercise during pregnancy. So here are the therapeutic managements for diabetes mellitus. Insulin, blood glucose monitoring, insulin pump therapy, or continuous subcutaneous insulin infusion, and test for placental function and fetal well-being, timing for birth, and postpartum adjustment. Cancer and pregnancy. Cancer and pregnancy. Cancer occurs in about 1 in 1,000 pregnancies. Occurs in 4.4% to 12% of patients with PIH or P. The malignancies most commonly seen in pregnancy are those that occur most frequently in women during childbearing years. Here are types of cancers for cervical, breast, ovarian, thyroid, leukemia, melanoma, and lymphomas. So, mental illness and pregnancy. Mental illness may precede or occur with pregnancy. Schizophrenia tends to have its highest incidence in adolescents and young adults, and so occurs in young pregnant women. Depression occurs almost 4 times more commonly in women than in men, and is often in young adults. It is most common mental illness seen in pregnant women. Any psychotropic medication taken by a pregnant woman should be evaluated for possible fetal harm. Mental illness may also occur in postpartum period.